Hello, today's topic is health and disability insurance, which is a follow-on from the topic on group insurance. Group medical insurance plans have been around for a while, and as most business owners know, health insurance is extremely important to most employees. Many employers therefore offer group health plans to employees and their dependents as a benefit for working with that particular company or employer. The employer may pay part or some of the insurance costs, and such plans usually cover the employee as well as his immediate family members. There are of course advantages and disadvantages to such plans. One advantage is that the cost is cheaper than it would be through an individual insurance policy. Another advantage is that there is no medical examination required if the free cover limit is not exceeded. Drawback is that just like any other group plan, nobody can customize their own policy. Under such plans, the negotiations take place between the insurer and the master policy owner, usually the employer or the association involved. Just to look at the type of benefit available under group health policies, it may provide a hospital cash, which is the payment per day of stay with a particular hospital, hospitalization cover itself, pre and post hospitalization expenses, and also it may cover outpatient care. These days, a cashless facility is available under such policies. The insured walks into one of the hospitals on the panel of the insurer and can get treated for his ailments without having to pay for his medical bills. If the hospital chosen is not on the list of on the panel of the insurer, that doesn't mean that no cover is provided, no benefit is provided. What happens instead is that the expenses have to be, or the costs have to be met by the member at that point in time, but may be reimbursed or is normally reimbursed after 15 days of following receipt of all documents. The concept of TPA or third-party administrator needs to be mentioned here. The TPA was introduced by IRDA for the benefit of both the insured and the insurer. The insured benefits through quicker and better service, while the insurer is expected to benefit through reduction in administrative costs and also reduction in fraudulent claims. The job of the TPA is to maintain databases of policyholders and issue them with ID cards with unique ID numbers, and then handle all the post-policy issues, including claim settlement. In terms of infrastructure, the TPA is required to run a 24-hour toll-free number, which can be accessed from anywhere in the country, and they employ medical practitioners so that they can answer queries received on those lines. For example, what sort of ailments are covered by the policy. There are of course exclusions, and these include all diseases, illnesses, injuries existing at the time of proposing the insurance. Also, diseases contracted during the first 30 days of commencement of the policy are normally not covered. Would be dental treatment or surgery unless hospitalization is required. Cost of spectacles and contact lenses are also not usually covered. Just to mention the concept of managed care plans at this stage, such plans help to control the employer's healthcare costs, and it is used to impart information and knowledge about healthcare in general. Managed care is provided through two types of services. Independent Practice Association plan, where the services have contracts with independent physicians to care for their patients. Alternatively, there is the group practice plan, where physicians are salaried employees of the service provider and provide service to the members exclusively. Okay, so now let's look at group disability income plan, which is another type of group plan. This type of plan provides an alternative source of income in the event of disablement through injury or illness. The level of benefit, of course, depends on the degree of the disability, and insurance companies have different definitions of different levels of disability. They usually define permanent disability as loss of eyes or limbs, etc. Loss of both eyes or both limbs are usually termed as permanent total disability, while the loss of one eye or one limb is usually termed as permanent partial disability. Then there is also a category of temporary total disability, which is said to arise when a person is confined to bed for a temporary period and is therefore unable to carry out their duties during that period. Just to give an example of what levels of benefits are available under a disability plan. One particular company, for example, one particular insurer, for example, offers an upper limit of 25 lakh for permanent partial disability and 50 lakh for permanent total disability. In this connection, the Indian Workmen's Compensation Act of 1923 needs to be mentioned. The Indian Workmen's Compensation Act of 1923 provides for the payment of compensation by the employer to his employees if personal injuries caused to them by accidents arising out of and in the course of their employment. The compensations required as laid down by the Act include 80,000 in the event of fatal injury and 90,000 in the event of permanent total disability. I note that the permanent total disablement compensation is higher than the fatal injury compensation. In respect of permanent partial disablement, Schedule 1 sets out the levels of compensation required, while for temporary disablement, the sum equal to 25% of the monthly wages is set down. The employer can, of course, take up an insurance policy against their liability, and various policies are available in the market to cover this liability. The coverage, for example, would normally include injury of employee by accident in the workplace, a disease of an employee contracted in the course of employment. The policies usually do not cover injury caused by accident while the workman is under the influence of liquor or drugs. Of course, it doesn't cover the scenario where there is willful disregard of safety rules. The insurance policies usually offer compensation at a higher level than required under the Act. For example, for fatal injury, up to 4.5 lakh may be offered. For permanent total disability, up to 5.5 lakh may be offered. Permanent partial disablement is paid out. The payout depends on the incapacity cost, the level of incapacity cost. Whereas for temporary disablement, up to 2,000 rupees per month for a period of 5 years is normally available. So to summarize, we've looked at the advantages and also the disadvantage of a group medical policy. We've looked at the cover available under a group medical policy. We referred to the TPA and the cashless facility. We referred to the managed care plans. We looked at disability insurance, and in relation to that, workmen's compensation plans.